One of the places we had to go, we had to climb stairs. So this is me 11 days postpartum. I had a vaginal delivery and I am climbing stairs. And Sarah, it felt like my hips were about to kind of split open. You're shaking your head like from the pain.
Yeah.
And it just dawned on me, like, even though mentally you're strong, you're ready to get back into things, your body is still different. So I'm so glad that you're catering to those moms in that time period. Is there a nutritional component to what you do?
Inherently, they go together, right? Like if you're wanting to move more, a lot of times you're also being more intentional with other areas of your life, like how you fuel your body, how you sleep.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here.
Hi, everyone. Welcome, welcome, welcome. Welcome to another episode of the Care Room with Dr. Cindy. I have another very special guest with me today. Her name is Dr. Sara Ionescu, and she has graciously agreed to join us today and share some of her wisdom with movement. But before we get started, I'm going to let her introduce herself and tell us all about her.
Yeah. So, hi, everyone. Thank you so much for having me, Dr. Cindy. So, I'm Dr. Sarah. I'm a family medicine trained physician. I'm a wife. I'm a mom of five little ones that are currently ages 8 years old and under. And I am an exercise enthusiast. And right now, I help busy moms create passion for movement as a way to feel stronger, feel more confident, feel vibrant, and inspire their families to do the same.
Yes, we love it. We love it. And people like me, Dr. Sarah, we need it. We need it. Because if I had my choice, I would not be on the treadmill. Not be moving. I would be, sitting at a computer all day. So this is good. We need your wisdom
Cool.
for people like me to get up and moving. But yeah, can you tell us more about how you got into exercise and movement and how your passion for it really developed?
Yeah, absolutely. So I was a swimmer from a very young age. My mom actually did not know how to swim. And so for me and my brother, it was like from the moment we were big enough to go to swim lessons, we were doing swim lessons.
Yeah.
And I sort of fell in love with it and ended up swimming my entire childhood. I swam in college. So, exercise and sport, like it was, I also did some running in high school, but it was always just part of my everyday life. And it was prescribed by a coach. So, I never really had to think about it. I just kind of showed up and did what I was told. And then when I graduated from college, I had this transition where I sort of had to figure out what does movement look like on my own when I'm not part of a team. And that was definitely a transition, but it ended up being fine because at the time I was single, I was working a job, like I had plenty of time. I ended up finding a community, joined a gym. And so that thread of movement as part of my life continued. Well, then when I made the decision to try to get into medical school, I got in, met my husband, did residency, started to have children. Things definitely changed. And the way that I thought about exercise, I was still thinking about it that way, but I was unable to meet the bar that I had set all those years before because now I had all these different roles. I was no longer a student and taking care of myself. I was a mom, I was a wife, I was a practicing family physician. I had all of these roles. And so doing the like 30, 45 minute super sweaty workout felt near impossible most days. And so then I would choose to do nothing. And I will say, kind of through med school and residency, I was able to find pockets of time where I could do that. And so I did, but I wasn't able to sustain it. So I would do it for 1 or 2 weeks, and then I would go a few weeks with doing nothing, and then I would come back. So then, fast forward, like I said, all these children, husband, job, I was doing not a lot of anything. And I was really beating myself up about that because I wanted to do more, but I could not see how I could fit it into my life. And I was doing things like walking our dogs every single day with my daughter outside, but I didn't count that. That didn't count as exercise. I wasn't meeting my bar. So I was beating myself up instead of being like, yay, you did this thing. And then there was one day when I was climbing the stairs holding her, and I got to the top and I was so short of breath that I was like, this is unacceptable. Like, I'm a young mom, I'm a doctor. This is my first baby at this point. Like, I need to figure this out because doing stretches of nothing with like 1 30-minute workout once a month is not going to keep me on the health path that I want to be on for myself, but also as a role model for my kids. And around the same time that that happened, I had this aha moment when I was in a room with a patient saying something that I had said like literally hundreds of times before to patients, which is, can you find 1 minute a day to move? Because I had had experiences with patients so many times where when we talked about getting active, we talked about how movement could affect their life in a positive way, but also affect maybe their chronic disease in a positive way. Many times, the obstacle that came up was time. I just will not be able to find the time. This doctor told me I have to do 30 minutes 5 days a week. And if I'm not doing that, that's not enough. But I can't even find 5 minutes. So, how would I ever be able to do those 150 minutes? That's when I started incorporating this. Can you find 1 minute a day to move? Because inherently, it's really difficult to say no to that question, I found. So inevitably, they would say, well, yeah. And then we would come up with a plan of what it would look like. Maybe you're going to walk up the stairs for a minute. Maybe you're going to march in place. Maybe you're just going to get up and walk around the couch, whatever it is. And those words were literally coming out of my mouth to a patient. And I was like, why am I giving this advice, but I'm not following this advice? Like,
Right.
I'm telling myself, it has to be 30 minutes. I have to be wearing a sports bra. I must be sweaty. But I'm
Right.
telling the patients they can start where they are. So why don't I do that? And that is sort of what started everything for me in terms of really making adjustments to my mindset about movement and getting to this point where, I eventually set a goal of like, I'm going to show up for myself 5 minutes a day, no matter what it looks like, whether it's a meditation, a stretch, maybe five
Right.
minutes of lifting weights. And I have now done that for over 1,000 days in a row because I set the bar to be reasonable and achievable as a mom. And what I've seen both in myself and in my patients is when you do that, inevitably, almost without trying, it's like your subconscious presents to you these opportunities of movement. Like, well, I could find another 2 minutes here, or I could find 5 minutes there, or maybe right before bed, I'll do this awesome stretch. And you start to identify as a person that moves their body and it's integrated into your life, as opposed to it being like exercise is a checkbox on your to-do list and you have to check it off.
Sure.
And so ultimately, that has gotten me to where I am today, which is being a movement coach because I sort of blended my physician training with this passion for exercise, but also passion for helping other moms be able to see and integrate it into their life in the way that I have been able to.
That's awesome. That's awesome. That's amazing. We talk about, like the SMART goals where they have to be achievable. Cause I think that's also have my schedule. I put in, okay, exercise at this time, 30 minutes. But it almost never happens because I'm like, oh, I have to finish this or I have to finish that. but I can certainly, walk around, the house probably, in a minute, get up and move. So that I never thought about it like, doing it in smaller pieces or pockets of time to add up to, I guess, like how the doctors always tell you need this certain amount, of exercise every week. But I never thought about breaking it down like that. That's awesome. Yeah.
Yeah. And I think keeping it so simple and like
Yeah.
removing as many barriers as possible where yes, we have evidence-based guidelines and all of that is wonderful, but sometimes it's like just getting started, and if doing 1 minute a day gets you started, then you can build, like, you can build on that, you can build to that, and I think letting it be where I mean, there are days where I will just roll out of bed in the morning, I still have my pajamas on, and I just get in the closet and I do something for 5 minutes because I know, like, that preps me for the day, and I know I gave myself some one-on-one attention, which is really important, I think, especially as a mom,
Yeah.
and especially as a physician mom like you are, where finding those pockets, maybe it's not going to be the 30 minutes like you said, but if it can be something like doable and bite-sized, and then you can layer in other things throughout the day to sort of add on to that.
Sure, sure. So, do you recommend any like plans, family plans, doing it together? What are your thoughts on that to keep
Yeah.
you accountable?
Yeah, absolutely. So I think there's a lot of different ways to stay accountable. I think letting activity with your spouse, if you have one, your partner, your kids, like whoever is within your household, I think is a wonderful thing. I think it's wonderful to have different avenues. So sometimes having alone time to do that is nice. Sometimes incorporating the kids is nice. Sometimes sort of a combination of that where there will be many times where I'm doing something and they're watching me and doing another activity simultaneously, whether that be playing with a toy or color, whatever it is. So I think there's many different ways that can look, but letting things like playing outside with your kids count, right? Because if you're outside and you're moving and they're moving, sure, maybe you're taking care of them and you're creating family memories, but that can also be exercise. Like that still can count. I think the accountability piece is a lot of times that something that can be really, really challenging for people. So I know for me, something that I find helpful is to write it down and be like, yay, whatever, celebrate that you showed up. And it doesn't have to be something like really long and drawn out. If you're a pen and paper person, you can scratch it down like that. If you are a more digital person, you can have like a running note in your phone, something like that. But part of that is also why I became a movement coach because I have seen with my clients, me helping them with the accountability piece and sort of bridging that gap from getting started to me helping them with accountability and then bridging to their like self accountability that I talked about. That can be really helpful also to enlist, whether it be a fitness type coach, a friend, somebody that has similar values, similar goals to you where it's not about judgment. It's not a oh you didn't do it, you're the worst. It's just like a gentle reminder, a gentle nudge of hey, this is what I'm doing. Like what are you doing? Let's build each other up and celebrate.
Thank you, Dr. Sarah, for that. So you mentioned your five babies, right? You mentioned that you get it done, you get your movement in. Can you tell us practically what that looks like, especially with five babies?
Yeah.
You know, I know I say babies, and the older ones don't like to be called babies. I have a 10 and a 7-year old, and I always call them babies, and they get mad. So you know what I mean.
Yeah. Yes. Yeah, they always say the baby so the baby is about to be 1, and they're like, "She's the baby, we're not okay, yes, but I call
You
them
get
all
it.
yeah, I call them all babies too." Yeah, so I think the biggest thing is it looks different every single day. So, there are days where during nap time, I might get on the treadmill and do a run, like I'm not like sprinting, but doing like a conversational pace run. There are days where I find 5 minutes to stretch in the morning. There are days where I'll do like a 15 or 20-minute strength workout. It just depends on the day, and I let it be flexible, and I give myself grace for that. In the past, I used to have a like, on this day of the week, I'm doing this. And on that day of the week, I'm doing that. And then I ran into, if that didn't pan out for whatever reason, I was giving myself a really hard time and being very judgmental of like, you couldn't figure it out, you couldn't show up. But what I've realized over the years and the more kids I have, the more flexible I can be with that, the more able I can like pivot and make an adjustment, the better everything feels overall, not just my self talk, but even the way I function as a mom and a wife is very different when I'm kind to myself about that. I think my biggest tip there is in my mind now, I always have like the workout that I want to do, and then I have a backup, and then I have a backup to a backup. So instead of like something falls apart, like the baby wakes up way earlier than I thought, or somebody's sick and we're not taking naps, or whatever wrench gets thrown in because of
And
life.
there are lots of wrenches with kids.
Right, exactly. Then I would just be like, okay, I don't have time to do the initially planned thing, but I'm going to go to this backup or I'm going to go to this backup. And those backup workouts that I like to call them are just ones that it's like, I don't have to think about it. I'm just going to show up and I know what to do. And that's really helpful because instead of spiraling out of control of like, well, everything's thrown out the window for today, it's just like, okay, that didn't work. I'll move that to later in the week. And now I'm going to do this. And usually those backups are around stretching because many times if the backup is required, it's a day that maybe is going to be extra challenging or taxing because of business or being a doctor or being a mom or all of the above. And so I find stretching to be a wonderful way to move your body that feels really good physically, but also really good mentally. And it's a wonderful way to sort of combine like a sort of a calmness with some of those more overwhelming moments. Even if it's 5 minutes, I find it absolutely makes a difference.
That's awesome. I really like how, and all I'm hearing as you're talking is that mindset is really important with the movement. It's really important for getting started. It's really important for keeping up with it and for forgiving yourself, especially, when you might not meet the daily expectations. That is awesome. Um, and I just had I just had a mindset shift. Like, wow, like, being kind to yourself. Yeah, yeah. So do you often incorporate like meditation while you're doing that, or tell us more? Tell us more
Yeah.
about
So it really depends on, again, like how much time I have and what I'm doing. I will say if I have my way and I have an ideal situation, I end every workout that I do with meditation in one form or another. And the reason why I do that is because one, I've seen a huge benefit with doing consistent meditation. And that was another thing that I thought I had to find 30 minutes or it wouldn't be helpful. But then I decided I'm just going to do what I did with exercising and start with like 1, 2, 3, maybe 5 minutes a day. And I did find that even that small amount made a difference. So I do try to incorporate that. One of the reasons why I do it at the end of the workout is I find that sometimes with exercise, especially if what you're doing is maybe a little more vigorous, maybe you are getting sweaty. Sometimes I find when that workout ends, even if I do a cool down, I almost need like a transition back to life, if that makes sense. It's like
Yeah.
it helps to have sort of like the meditation is a nice way to connect the physical workout and then also get my mind in a really good place to like wrap up that and then move back into whatever role I'm going to be stepping into at the end of that. Many times I will combine the stretching that I do with a meditation as well. Or I guess meditation can have many different ways that it looks, but a lot of times I'll stretch and use some mantras that I find to be helpful. So sometimes it'll be like I am statements like I am strong, I am calm, I am confident. Sometimes it will be like one of my favorite ones that I came up with is I embrace change with peace and calm. So sometimes it'll be just reciting whatever mantra feels good at that time. Other times I might put on a guided meditation, but then instead of just sitting with my eyes closed, I will actually move through some stretches because I find that combining those two things is incredible at times.
Sure, sure. Oh my gosh, Dr. Sarah, you're dropping the pearls today. So, can you tell us what a movement coach is, what you do, what you offer to clients?
Yeah. So I think I kind of created the term movement coach because sometimes I feel like exercise, even though it's not, if you look it up in a dictionary, I feel like there's inherently this like there's like this connotation around it of like what it has to look like, what it has to mean. Whereas movement is like most of us move our bodies, right? Like you moving is part of your everyday life. Breathing is part of your everyday life. And much of what I talk about, especially with moms that are newly postpartum, has to do with breathing and reconnecting to your body with that. But so that's kind of where the movement part came in because it felt more neutral and less judgmental to me. I guess when you think about exercise on like social media is immediately what I think of, where there's many definitions, there's many bodies that you see where it can make you feel like, well, I can't do that, so then I guess I just do nothing. So that's kind of where the movement coach name came from. Yeah, I think we can all relate to that, and I think especially like part of my impetus, my inspiration to do what I'm doing is thinking of myself when I was postpartum the first time, where I was doing exactly that, like Googling and looking for workouts. And everywhere I looked, it was like these women that were saying they were supposedly 8 weeks postpartum, but they were doing these like wild high intensity workouts. And they were like totally in these like super tight clothes and like looking really lean. And I was like, well, that's not me. Like, that's not me. So I can't do what they're doing. And like, there wasn't a lot of modification. There wasn't a lot of like gentleness and guidance of what it means to be postpartum. And so anyway, that I could go off on that for like an hour. That's a whole separate podcast. But so anyway, that piece of things inspired me about the movement thing. And then what I specifically do in my movement coaching is really sort of a combination of a lot of the mindset work that we've, touched on here, but then also actually doing movement. So my coaching sessions will be like, okay, here's where like we go over where you're starting from. We kind of come up with a plan and I show you different things. We move together. So yeah, it's sort of this unique situation where I blend the mindset stuff with actually moving. And then, inherently with my background of family physician plus mom of five, like I bring a different knowledge base to the picture than, like a more traditional personal trainer type of person would.
Okay. But is there any component of personal training? Say like you're a postpartum mom, you want to get rid of like the belly fat or get that like we were talking about those postpartum moms who look so good and you're like, "Wait, what are they doing?" Is that a component of it? Or
Yes.
are you like
Yeah.
going to the gym? Okay, weightlifting or
Yeah.
what?
So there's not really going to the gym piece, but there is a kind of figuring out what the goals are and then creating sort of a plan of like, here's where you are, here's what the goals are, and here are the things we can do to get there. And I think especially around postpartum movement, there's not a lot of like relatable content available in terms of what that looks like when you are immediately postpartum and how to heal your body in a way that is safe, and then to get you to where you can be at a level where you're working it out and moving in the way that you want to, that also feels good and is safe for your body. So yeah, I think it's kind of all of those things sort of wrapped up in one.
My gosh, I'm so glad that you are catering to that population of people. I'll share a story. So my youngest, she's 7 right now. But when I had her, I was about to start family practice residency and helping me at the time. And then I remember on orientation, they're taking you around, to the hospital, different places. And one of the places we had to go, we had to climb stairs. So this is me, 11 days postpartum. I had a vaginal delivery and I am climbing stairs. And Sarah, it felt like my hips were about to kind of split open. You're shaking your head like from the pain.
Yeah.
And it just dawned on me, like, even though mentally you're strong, you're ready to get back into things, your body is still different. It's still different in that time period. So even though you have those goals, yeah, I wanna get back in shape and I wanna, do all of this and I wanna get back to my daily activities. Sometimes it's not feasible to, get the body to cooperate with what your brain wants it to do. So I'm so glad that you're catering to those moms in that time period and doing, like time period appropriate things or with that in mind. So that thank you, thank you, thank you. Thank you for taking care of moms during that time. My other question for you, is there a nutritional component to what you do?
So far that's been very client specific, not necessarily, but it sort of inherently they go together, right? Like if you're wanting to move more, a lot of times you're also being more intentional with other areas of your life, like how you fuel your body, how you sleep. Interestingly, it hasn't necessarily been like an over, like significantly part of the coaching sessions. However, my clients have said they have noticed things like they're making healthier choices without it feeling as hard. And I think the reason for that is because whenever you are doing things to take care of your body, like moving more, you tend to gravitate towards things that help your body feel better, which is eating foods that are more nutrient dense and that are going to sustain you and help with your overall health as you age. Stay tuned. That may become part of it as things grow and change over time. But yeah, I think it's really interesting to see how even when you're helping people with one specific area, it tends to kind of bleed into many of the areas of their life.
Yeah, yeah, yeah. Oh my God. Thank you, Sarah. Sarah, if anyone is watching and they want to have be part of your world, have you as a movement coach, how can they find you?
Yeah, absolutely. So I will say probably the best thing is to find my YouTube channel, which is Dr. Sara Ionescu. So it's at DrSaraIonescu. That's a wonderful way to experience me right now. I have loads of videos on there. I actually have a
Yes.
playlist that's specific for pregnancy and postpartum workouts, and there's actually like a 3-part video series on there that's all about like getting back to movement postpartum, starting with your abs for people. And then that's where I am on Instagram and Facebook as well. It's Dr. Sara Ionescu everywhere. All those places, I have links to sign up for a free movement coaching consultation where we can kind of talk more about what that looks like. And then people can always sign up for my email list, which is at my website, which is drsaraionescu.com.
Perfect. We love it. We love it. Do you do any in-person coaching or is it all tele?
So far, it's all been telemedicine, or not telemedicine, but it's all been virtual coaching. Do also do live workouts that are virtual. So I've been doing those on Zoom. I am hopefully going to be scheduling one in the next few weeks here. So if whoever's interested, follow me on social media, Facebook, Instagram. I will announce when that's going to be, but that's something you can just sign up for. And it's essentially moving like I do in my YouTube videos, but we do it live and in community.
Perfect. Love it. Guys, you heard it. So it doesn't matter what state you're in, it doesn't matter what country you're in. You can
Yes.
totally go online, sign up, and work with Dr. Sarah. Thank you, thank you, thank you, Dr. Sarah, for letting us pick your brain today and sharing all those pearls of wisdom. Even Dr. Cindy is going to use some of that in her own
I
life.
love it.
But it was truly,
Awesome.
truly a pleasure having you with us today. And we hope it was as fun for you.
Yes, absolutely. Thank you so much for letting me be here. It was a wonderful chat, and I hope your audience loves it.
Perfect. Thank you. All right, guys. Until next time, take care.
Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.